Hi, and welcome back to Type 1 Diabetes Explained. Although we focus primarily on Type 1 diabetes for this series, it is helpful to know a little bit about Type 2 so that you fully understand the difference. Like Type 1, Type 2 is a disease that affects how your body uses insulin and glucose. In Type 1, your body does not produce enough insulin, but with Type 2, your body isn't able to effectively use the insulin that it is producing. People with Type 2 diabetes are said to have insulin resistance. Unlike Type 1, Type 2 occurs more often during adulthood, with those between the ages of 40 and 50 at most risk, hence its former name of adult-onset diabetes. But unfortunately, more and more kids are being diagnosed with Type 2 diabetes, most likely due to childhood obesity. Type 2 is the most common type of diabetes with over 29 million cases in the US. Prediabetes is a precursor to Type 2. Prediabetes is where your blood sugars are higher than usual, but not high enough to be classified as having diabetes. There are estimated to be 85 million cases of prediabetes in the US. The symptoms of Type 2 are relatively similar to Type 1, with just a few differences. Here are the symptoms of Type 2 diabetes: being very thirsty, excessive urination, blurry vision, tingling or numbness in your hands and feet, fatigue or feeling worn out, hunger, unintended weight loss, and an increased number of infections. While it is believed that both Type 1 and Type 2 diabetes can be caused by a combination of genetics and environmental factors, Type 2 diabetes is often attributed to being overweight, inactivity, and metabolic syndrome, which includes high blood pressure, high blood sugar, high triglycerides, low HDL cholesterol, and belly fat. However, just because someone has Type 2 diabetes, this does not necessarily mean that they are unhealthy or overweight. It is possible for someone who is physically fit and healthy to get Type 2. This is often because Type 2 diabetes has a stronger genetic correlation than Type 1, meaning those with family members with Type 2 are more likely to get Type 2 themselves. If your doctor thinks you have Type 2 diabetes, several lab tests may be conducted to diagnose you, including A1C, which indicates an average of your blood glucose over the past 2 or 3 months, the fasting plasma glucose test, also known as a fasting blood sugar test, which measures your blood sugar on an empty stomach, and the oral glucose tolerance test, which checks your blood glucose before and after you drink something sweet to measure how well your body handles the sugar. If you've been diagnosed with Type 2 diabetes, there are many different ways that you can manage it, including both medications and lifestyle changes. For some people, exercising regularly and eating a healthy diet is enough to control their blood sugars. However, there are also many different types of pill and injectable medications that can help treat Type 2. This is one major difference between Type 1 and Type 2. Exercise and diet may be enough to treat Type 2, but you will generally need insulin to treat Type 1. Insulin is a method for treatment of Type 2 diabetes, but it is often not used for long periods of time. Rather, it is used as a temporary, short-term fix for erratic blood sugars. There are several things that you can do to help manage your blood sugars with Type 2 diabetes. Weight loss is one of the big ones. By losing weight, you can lower your blood sugar significantly and help reduce the likelihood of other complications of Type 2 diabetes. Physical activity also helps control Type 2 and helps you lose weight. Diet is the other large component. By watching how many carbs you are eating, you can help your cells use insulin more effectively and also need less insulin overall. And finally, getting better sleep can help you lower your A1C. Hopefully you now understand more about Type 2 diabetes and how it is similar to and different from Type 1 diabetes. As always, visit our website at t1dexplained.org for more information and helpful resources.